an evolving situation, and we've all been kind of dealing with it over the past few months. So we thought it would be a good point to kind of present some of the facts that we know and some of the rumors that are going around and try to address those. So I will be going over a few points. Feel free to ask any questions that you have. I'm looking at the chat box, so I'll try to address them as they come in. And this is overall a little bit informal. I just want to be as helpful as possible with the information that we know. With that said, let's go ahead and get started. So we're going to address a few major topics regarding masking, and then diagnostic and antibody testing, and then staying safe and healthy during this environment while this is all going on. So myth number one is that only an N95 mask can protect you from the coronavirus. I think we've all seen, what happened, especially early on with masking and everyone kind of rushing to buy N95 masks. So is that true? And the answer is no. There are a few different types of masks, but when we break them down, there are three different main types. The first is the N95 respirator. This is the most secure mask, I would say, but it's predominantly designed for healthcare workers who are dealing with airborne particles. So our physicians wear this when they are in a particular situation. When they're seeing a patient face-to-face who has COVID, they put an N95 respirator on themselves and on the patient to prevent those particles from being spread out. When they're doing a procedure, they wear this type of mask on an N95 to protect them against the airborne particles. The second, which is very common, is the medical masks. These are the masks that also provide protection. They're specifically designed to prevent droplet transmission. And this is the mask that our physicians wear in the hospital anytime else. So when they're not performing a procedure on a patient who has COVID, when they're just walking around or when they're outside, this is the mask that we kind of recommend doctors and patients wear. And then the cloth mask is a third mask, and this also reduces the risk of spread. I think it's a matter of kind of personal preference. This is not as safe as the medical masks, but again, there's variability. So if it decreases the particles from coming into contact with your nasal and mouth mucosa, it does significantly reduce it as well. So I would say, unless you're in a healthcare setting and dealing with patients directly, the medical masks and cloth masks provide great protection. Just make sure to cover both your mouth and nose to prevent the particles as much as possible. Obviously, those are not as airtight, and that's the limitation with them. The second myth is that wearing a mask for an extended period of time is dangerous to health. This is also not true. The mask is effective as long as it covers your nose and mouth, and it does not lead to any major complications in terms of breathing. The COVID particles are actually much bigger than the oxygen particles, so you will have no problem getting oxygen through the mask. It will go through the mask, but the COVID particles will not. I believe they're about 20 times bigger. So this mask definitely helps with that. What I would say is you would want to avoid masks with vents or bandanas. And again, it goes back to the same topic. The main goal is to prevent the COVID particles in coming to contact. So you don't want a bandana that's porous or has open parts because that allows them to get in. And same with a vent. The vented masks protect you, but because of the vent, those particles can go out and expose other individuals. What we aim to achieve by wearing masks is keeping our particles to ourselves as much as possible. So if I wear a mask and you wear a mask and we're talking at 6 feet apart, I keep the particles around me and you keep the particles around you as much as possible. That's the easiest way to really think about it. Okay, let's go to the next one. Employees who tested positive, who are infected with COVID must provide a negative test before returning to work. Also not true. So this is a chart that's put together and it looks confusing at first, but let's go through it together because it's actually simpler than we thought. I think the first thing that I'd like to, before we go through this, is a negative test is not required to return to work. So let's go through the outline. We're starting at the top left where an employee has fever or symptoms and worried about having COVID. So first thing you want to do is separate that employee from the rest of your workers. So you want to send them home. And then the employee can seek medical advice. If COVID is not suspected, if this is just a routine cold, they don't have the symptoms of COVID, then they can return to work when they feel healthy. If COVID is suspected, then they can undergo COVID testing. And if it's negative, same thing. They can just kind of return to work when they feel better. If they do test positive for COVID, they can return to work after symptoms improve and they no longer have symptoms and no fever for 72 hours. The employer should also inform the employees at the place of work about a possible exposure at work, but must maintain confidentiality and the identity of the employee. I know this is a very tough topic. I think we're all kind of struggling with it. I totally understand, just because, I think there's a lot of fear out there. So we're dealing with it, with our own physicians, where we have a physician who has a family member and they're not sure whether the family member has COVID or not. And it leads to this chain reaction where, everyone who's been in contact with someone is worried about it. But I think the main thing that you have to remember is, as long as you separate yourself and you return when you don't have symptoms, for the most part, you're okay. If you did have a COVID testing, you certainly want to make sure, and you were positive, you want to make sure that the symptoms have improved for more than 10 days and you don't have a fever for 72 hours. But the key takeaway, again, is you do not need a negative COVID test to come back to work. So there's no need to wait for a negative COVID test. As long as the symptoms have resolved, the employees can come back. Myth number 4 is regarding antibody testing. And it's really a controversial topic that's coming up now. And we're trying to decide whether antibody testing is helpful in terms of determining immunity to COVID. And this is kind of a chart that we put together to try to clear up some of this testing criteria. So I'll just give you a little bit of a background, what happens with your body when you're infected with any kind of disease, but in this case, COVID. So initially, when you're infected, you have the disease. The COVID is in your system and it's causing symptoms. You have fever, you have cough, and that's the diagnostic test. That's the role of the diagnostic test. And it can kind of tell whether you're sick with COVID or not. Those are the drive-throughs that you see that we have with the nasal swabs, and this test will tell whether you have COVID or not. Once you go through COVID, once your body fights it off, it forms antibodies. However, because COVID is such a new disease, the testing is not perfect right now. Between that period when you had COVID and your body is building antibodies, and incubating potentially, there's no real way to tell whether you have anything really or you've been exposed at all. So it really is not useful at that point. If you want to find out if you've ever had COVID-19, the diagnostic test won't answer that, because the diagnostic test is essentially, do you have COVID currently or not? The antibody test could potentially help in the future. And then in terms of immunity, same thing. The diagnostic test will only tell if you have COVID currently or not. And the antibody test is really kind of unknown. I think the vast majority of the literature is pointing to the fact that once you do have antibodies, they do work pretty well, but it's still unknown because we have a few cases of individuals who have become reinfected. We're still finding out more about whether this disease mutates or any other special circumstances with it. So I would just say, unfortunately, due to the early age of this disease, it's tough for antibody testing to be useful. And again, this is just kind of going back to the whole vaccine. I think everyone's kind of waiting for the vaccine. What the vaccine does is will take a part of the protein of the COVID that's not active. So imagine it's kind of like a shell of a car. You can just take like a door of the car and introduce the body to the door of the car. And what that does is it helps your body build antibodies against the car. And then when the real car comes, that's something that you don't want in your body. And that's how vaccines work. They help you build antibodies without actually exposing you. That's the difference between getting infected and building your own antibodies, and getting a vaccine and having antibodies built by your body, which can actually even be better. Okay, let's go on. Myth number 5, it's best to avoid seeking medical care right now. I think we're all seeing this. This is a big problem, and it's absolutely not true. So a couple of things to remember is, COVID is spread via aerosolized particles. That means if you're talking and you're not covering your mouth and you have COVID, the particles can go in the air and they can stay in the air. So anytime you're going into an establishment that has indoor facilities of any sort, the criteria comes down to how the screening is at the entrance and how the disinfection is. We've addressed this to the extreme. So at our medical centers, at our offices, anywhere that you go that's a Kaiser Permanente facility, and I would say most healthcare facilities actually, we have screening at the entrances. So we check for patients and we check for symptoms. We do frequent disinfecting of surfaces to make sure if there are any particles in the air that sat down, we wipe them off. We have very limited visitation policies to decrease the traffic. We have mask requirements both within and outside the hospital for our physicians and the patients who come into the hospital. And what we've done to address our patients is we are now offering a multitude of different ways to see physicians. So this kind of forced us into kind of turning this big Kaiser boat, as we like to call it, really quickly, which we never do. And we've shifted a lot of our care virtually. So previously, if you had a urological problem, you would have to definitely go into the office. Now we're seeing 80% of our urology patients remotely. So this is something that's really important to pass on, because what happens when patients do not follow up with their care is things end up being worse down the line. So we're seeing cases, unfortunately, where a patient has, left lower quadrant pain. If they show up to the ER, they would be greeted with, specialized circumstances. They would have a mask on. They would get a CT scan, for example, and they'll be diagnosed with simple diverticulitis. The treatment for that is very simple. It's a bout of antibiotics. You can go home with some antibiotics and you'll be fine in a week. Unfortunately, because there is this fear of COVID being in the hospital, these patients are not coming in. And what we get then is delayed care. So instead of being simply resolved with antibiotics, now we get this infection that gets worse and worse. And they end up showing 2 weeks later via ambulance when they feel really poorly. And we start to look at them and see, well, we've had an abscess now. We've had a perforation of the colon, and that becomes a lot more complicated. So to address that, we've done all these virtual things. We've really shifted our care online. We have drive-through pharmacies. We have drive-through testing. We ship our products in pharmacies via mail. So we're doing it all we can to really encourage our patients to get the care they need in order to prevent worse outcomes down the line. That's what I would really want to share. And the one thing that's really important here is with the flu coming up, I would highly encourage everyone to take the flu vaccine. I know it's not a perfect vaccine. The flu vaccine is somewhat of a guess. I know everyone hates that. The doctors hate that too. It's not a perfect guess, but it does work really well sometimes. I think last year it worked about 85% of the time, which is phenomenal. That's why we didn't have a big flu year last year, because the vaccine worked well. And this year it's going to be more important than ever, because the combination of the two is what everyone's afraid of. If you end up getting the flu and COVID or vice versa, they both really weigh on your respiratory system and they can cause significant problems. So I would really encourage, this is kind of our big message. We are really happy to serve our patients, and we have really introduced all these alternate care locations. So I would encourage you to check them out. Let's go to the next slide. And then here's the playbook for returning to workplace. This is a great handbook that Serena can actually provide in terms of location. And this really talks about, the things that need to be checked off and how we're going to get from this phase of COVID kind of taking over our life to returning to work at normal in the future, and how it's going there.